Awesome. Well, good afternoon, everyone. Thank you guys for joining us for this Part D seminar. So we're going to provide some tips and tutorials on everything about doing a Part D review for this open enrollment period. So as you can see, my name is Kyle Sadorf. I am a financial representative out of the Lancaster office for Everence. I also do office hours here at Landis Homes every second and fourth Tuesday of the month. So I earned a bachelor's degree in finance and management from Geneva College, which is out in Pittsburgh, Pennsylvania. I grew up in Ephrata, and I also currently live there today. So I've been with Everence for, it'll be 2 years this November. And like I mentioned, I'm also here at Landis Homes every second and fourth Tuesday of the month. So many of you are familiar with Everence, but those who aren't, we just want to give you a brief overview of who we are. So Everence is a faith-based financial services organization, and we were founded on the values of stewardship and mutual aid. Our mission is to work together with our members to empower financial well-being for faith-inspired living. Historically, we have aimed to meet the needs of the communities we support, and that led us to offering Medicare supplement plans beginning in 1980s. And while we don't sell Medicare Part D plans, we have been offering some formal resources and options for reviews since 2020. So for Part D, there's 3 significant changes to the program this year. First, the out-of-pocket maximum for 2026 is going up to $2,100 for all covered drugs. So that means that no individual will pay more than $2,100 for their covered prescriptions in 2026. Once someone meets that out-of-pocket maximum for the year, they'll move right into catastrophic coverage for their prescriptions. Also, for 2026 will be the first year we see results of the drug price negotiations that have now been allowed between the Department of Health and Human Services and drug manufacturers. So as a result of this, 10 brand name drugs will experience some price decreases. And finally, in 2026, all Medicare Part D plans will again be offering a Medicare prescription payment plan to allow a beneficiary to spread out their drug costs over the course of the year. So each of these items will be more relevant as we walk through some of the information this afternoon. So we're going to use a lot of terms related to prescription plans. So before we kind of get into the information, I want to make sure that we understand what the terms that we're using are. So first is Part D. This is Medicare's program that provides those standalone prescription plans. Next is what's called PDP, and that is short for your prescription drug plan. Formulary is the list of covered drugs on your current plan or any prescription plan. Preferred is a term that we use to talk about the relationship between a pharmacy and a prescription plan. So a preferred pharmacy is one that has the best contract with the plan and will typically cover your drugs for the lowest cost. A pharmacy can be in-network without being preferred. So this typically means that you can still use that pharmacy because it's in-network, but you may pay more for your medications than other in-network pharmacies because they may not be preferred. So premium, this is the amount that you are charged each month to be enrolled in your prescription drug plan. Deductible is the amount that you must pay first before the plan starts covering your prescriptions. So until that deductible is met, you will pay for the full retail cost of your medication. So if the deductible is $500 and your medication's full cost is $50, well, you'll pay that each time that you fill your prescriptions until you reach that $500 deductible. At that point, then you may only pay like a $10 copay to fill the medication. So that's a good segue into that next term there, which is copay. So copay is a set dollar amount that you may pay for your medication, such as like a $2 copay. And then coinsurance, on the other hand, is a percentage. So instead of a set dollar amount, you may pay 25% of retail costs. That would be coinsurance. So there's also tier levels, as you may see on your plans. So tier levels are how plans divide up the prescriptions in their formularies. The tier level of a medication will determine the cost. So typically generic medications are at your tier 1 or tier 2, while your brand or higher expensive medications may be tier 3 or higher. And finally, we have restrictions and barriers imposed by a prescription plan to make sure that you really need your medication. So common restrictions are prior authorizations. So this is when a provider has to show proof that you need a medication. There's also step therapy, which is when you have to try to lower cost of your medication to see if it would be effective before a Part D plan will cover you for that requested drug. And there's also quantity limits. So when you are allowed to only fill a certain amount of the medication in a specified time. So a good example is like 30 tablets in 30 days. That's a quantity limit. So that's the vocabulary for Part D. So now we kind of went over the vocabulary. We're going to look at what we'll talk about today. First, we'll give you some tips on what to have available going into your Part D review. Next, we're going to touch on some unique situations that may impact how you do your review. Third, we're going to walk through an example using a simple medication list. And then finally, we'll talk about the enrollment process, and we'll also answer some frequently asked questions. So we'll also stick around for a couple minutes after the presentation for you guys to ask specific questions to us. So feel free to come find one of us and ask your questions. Throughout the presentation, you will see some boxes appear that have a light bulb on them. These are just helpful hints that relate to that portion that we're talking about. All right, so starting with what to have available. So you want to set yourself up for success by making sure you have the right information ready and with you before you go into your Part D review. So perhaps the most obvious thing is that you'll need to have ready is your current medication list. But it's not just the medications named, it's not just the medication names that you need to have ready. For each medication you'll take, you'll want to have the name, the dosage, the type or size, frequency or amounts, and the fill schedule. So that may sound overwhelming, but most of that information is right on that pill bottle or tube that you guys have. It's just helpful to know exactly what you're looking for. So even simple mistakes, such as using brand name or choosing a capsule instead of a tablet, can cause larger increases in cost and provide you with some inaccurate estimates. So we're going to show you two examples so you can see what this information looks like depending on the kind of medication that you use. So we'll look at the common medication in a pill form, which is going to be atorvastatin calcium, and then we'll look at a medication that comes in a bottle. In this case, we'll use an eye drop that's called Lumigen. So we'll walk through this relevant information that we have on the screen here. So first, we have the name. Atorvastatin is the generic version of Lipitor, but we're careful to use the generic version since that's what's been prescribed. Lumigen is a brand name. So, and while it does have a generic, we're going to say that the brand name is necessary. So the dosage for atorvastatin is 40 milligrams, and for Lumigen, we're looking at the strength of the solution, which is 0.01%. So for type size, the atorvastatin comes in tablet form, and the Lumigen is going to come in a bottle of 7.5 milliliters. So frequency or amount helps determine how much of medication we need each time we fill it. So for the atorvastatin, this prescription is for 1 tablet daily. For the Lumigen, it's for 1 bottle. So note that we do not need to know how many drops per eye in this example. That kind of information isn't necessary. And finally, we need to know how often to fill the medication. So for atorvastatin, we're filling it every 30 days, meaning we need 30 tablets every 30 days. And for the Lumigen, we're filling it every 90 days. So 1 7.5 milliliter bottle will be filled every 3 months. So the information we need for the eye drop will be the same kind of information you would need for an inhaler, ointment, or a cream. So the strength or concentration size, the size or tube the size of the tube or inhaler, and how often you are filling one is all the same information. A quick hint here is that you can either gather your medications and have all your boxes or your bottles and boxes in front of you, or you can simply just make a list of all that necessary information for you to have when you start your review. So there's some other things that you need to have ready for your review. So you'll need your zip code, what pharmacy you prefer to use, and any alternative pharmacies you'll be willing to use if you want to save some money or take a look at costs. A couple of tips here. First, picking a pharmacy for your review does not lock you in to having to go to that pharmacy, but it will give you a more accurate estimate of what your prescriptions will cost, because the price can vary with different pharmacies that you go to. Second, while it's not always the case, some smaller local pharmacies can have higher costs. If paying a little more to support your local pharmacy is a priority to you, that's fine. But if you'd like to see what savings could be, it's a good idea to at least add one additional pharmacy, like a commercial one, like a CVS or like a Walmart, for example. So the final information you might need for your review is your Medicare number. So this will be necessary if you plan to enroll in a new plan at the time of your review. Also, if you have an online My Medicare account through Medicare.gov, you'll need to have that login information with you. So doing a review through My Medicare account will create a faster, smoother experience. But don't worry, if you don't have a My Medicare account through Medicare.gov, you can still do it by looking through your zip code. All right, so here you can see everyone is going to start by going to this website. So it's going to be www.medicare.gov/plan-compare. So there are two different options available. First, like I mentioned, you can log into your My Medicare account, and the benefits of doing this route are that you can see your current coverage, and you can use the saved drugs or for pharmacies that you already have in there. Or if you don't have an account with My Medicare, you can simply just start by reviewing the plan and entering your zip code here. So let's talk through some unique situations that might require you to do things a little differently. So one situation is if you're using or you're living in a continuing care retirement community like Landis Homes. So if you're using the community's institutional pharmacy, it can be a little harder to locate that on the Medicare.gov website on the Plan Finder tool. It's important to know what the pharmacy name is instead of just searching your community's name. You want to make sure you're searching that pharmacy. Also, in talking with some of the social worker teams, we know that Phoebe Pharmacy is the one that's on campus here at Landis. So far, that has been showing up in the Plan Finder tool through Medicare. It's not in network for all the plans on Medicare, but it is showing up so you can get an accurate idea of costs. So another situation is, what if I take a medication that's not covered by my Part D prescription plan? Well, you don't want to include any medications that are not covered, as it will show you paying the full retail cost, and it may give you an inaccurate representation of what your total out-of-pocket costs would be. So some medications that are not covered by your Part D plans include vitamins and supplements, such as like iron. There's some medications received in like a doctor's office or an outpatient facility. This is something like infusions or injections. And there's also some non-standard medications such as like, for example, Armour Thyroid. So coupon sites like GoodRx can be a good option for you if you want to or you need to take a medication that's not covered by your Part D prescription plan. So you can also use the coupon site like GoodRx for medication that is covered through your plan to just get a better deal. But keep in mind that if you're filling the prescription that is covered under your Part D plan through GoodRx, that is not going to fall under your insurance, so it's not going to count towards your deductible or any copays that you may have for that prescription. Alrighty, so now we're going to get into the fun part here, which is getting to the first part of reviewing and walking through what it looks like to do a Medicare Part D review. And like I said, we're going to use a simple medication list. So here's a list that we're going to use. It includes rosuvastatin calcium, metoprolol, I'm going to have a hard time pronouncing these prescriptions, but metoprolol tartrate, and levothyroxine sodium. So a few things to note about these medications. Even simple lists may contain some information that can be missed or entered incorrectly. So metoprolol actually comes in two forms. There's metoprolol tartrate and metoprolol succinate. So for this example, this person's taking the metoprolol tartrate. They're also taking 2 tablets a day. So refilling every 30 days means that they need to fill a prescription, or they need to fill 60 pills each time they get a refill. You can also see that levothyroxine sodium is a tablet and not a capsule. So levothyroxine sodium tablets are very inexpensive, but levothyroxine capsules are not. So it's just important to make sure you have those details. If you accidentally put in a capsule, it will come up as not covered when your actual medication may cost a lot less. So again, just be sure you're having all the accurate information in front of you and ready before you start that review. Alrighty, so let's get started here. So as a reminder, we're going to go to medicare.gov/plan-compare. So you can see that right now, as of October 1st, so we're well into the open enrollment period here, where you are now able to take a look at the plans for 2026. If you have a My Medicare account, you'll sign in on the left, but we're going to use the box on the right and put in our local zip code. So we want to be really clear that these plans can vary from state to state. The plans are going to show that plans that you'll see in this example may or may not be available in the area. And if they are available, the premium and deductible could be different. So we're just not recommending that these plans you see in this presentation, we're not officially recommending them as they may not be the best fit for you, even if you have these exact same medications. So before we go into that, what if I have a My Medicare account? So if you did your review through your My Medicare account previously, you wouldn't have to input your medications or pharmacies individually. Instead, these will be saved to your account, though you can edit the list if you need to. So we also want to point out that reading your results will be the same except for 2 things. So if you have a My Medicare account, first, you'll see your current prescription drug plan. That'll show up in the results list. The second, the results list will not include any, the first thing you'll see is that current plan that you guys are on, okay? That'll show up first in that results list. Second, the results list will not include any plans that don't work with the pharmacies that you guys already have pre-saved in that account. So we'll take a look at more results and details and what that looks like. Alrighty. So after you've entered your zip code and selected Medicare Part D plans, you will see this screen populate. Now, if you know that you are receiving health and drug cost assistance through one of these programs, you want to make sure that you select that program. If you don't use any of these programs, you're simply going to select, I don't get help from any of these programs, and then you'll hit that continue button. After we make the selection on the previous step, we'll then be prompted to add the prescriptions that we take. So this can be done by hitting the add another drug button, where you can enter the prescription that you take, the dosage, the frequency, all that important information. Once all your prescriptions are added, you should see them listed like this on the screen. From there, you will hit that Done Adding Drugs button to move on to the next step. So now we've entered all our prescriptions, we're going to input the pharmacies we want to use. So you can add up to five pharmacies to compare costs. Once you enter your location and the pharmacy name, you want to click Find Pharmacies. After you add the ones you want to select, you will then hit the bottom on the right that says Continue to View Plans. It's not shown on the screen, but there is a button on the bottom of that page that says Continue to View Plans. Now you'll see all the different plans available to you. Medicare.gov will automatically sort the plans by the lowest drug plus your premium costs. So how to read your results. So when you check the top 3 plans that you want to look at, and then you click compare, you will see the 3 plans listed next to each other in columns like you see on the screen. The name of each plan is at the top, and the corresponding information for that plan is listed below. At the top, you will see each plan's star rating, its monthly premium, and deductible. So while these pieces of information are helpful, they will not give you the whole picture of that plan. Picking a plan simply because it's the lowest premium does not guarantee you'll save the most money in that plan, and picking a plan with a higher premium does not guarantee that you'll have the most coverage. Below the overview, you'll see how many of your drugs are covered by each plan. In this case, all the 3 plans will cover all 3 medications in our example. Below the covered drugs, it shows the total. There we go. It shows the total drug and premium cost, meaning this number takes into account what you would pay in premiums and also co-payments or any co-insurance that you would pay to fill your prescriptions. And this is where the drug costs and preferred pharmacies come into play. So if I was committed to Walmart, for example, it would make the most sense for me to enroll in the Humana Value RX plan. While it has the highest premium of the top 3 plans, its preferred pharmacy relationship with Walmart makes it the most cost-effective plan. However, if I wanted to find the lowest cost, it obviously makes the most sense to enroll in the WellCare Value Script plan and use CVS or Giant pharmacies or the mail order to fill those prescriptions. Because the WellCare Value Script's premium for 1 year would be $98.40, I can assume that all 3 of my prescription drugs would cost $0 to fill at CVS or Giant. Once you determine the plan you want to investigate, click on the plan details button at the top here. So once we enter the plan details, we'll see the plan name, the type, the ID, and the contact information at the top. This is also where we'll see a breakdown on what we will pay monthly premium versus the estimated total drug costs. Below that, the overview will remind us what the total monthly premium is. Jumping ahead. It will remind us what the total monthly premium and the total drug deductible is. So staying in this plan details part of Medicare.gov, below the overview, we can double check our drug list and pharmacies. So there are buttons to change your drugs or pharmacies if you notice that something is off. Or if you want to add a different pharmacy or to see cost comparisons, you can also do that with another button that is there. In this example, we have 2 in-network pharmacies and 3 preferred pharmacies. So what we're seeing in this example is likely the best case scenario for the coverage. So we're skipping over some other items that are on that drug plan's detail that just aren't as helpful to us, and that's going to be like the total yearly costs and things like that. Instead, we're going to look at the estimated monthly cost. So you can see here that the best pricing is with our preferred pharmacies. So CVS, Giant, or mail order. It will cost us nothing to fill those medications. At our local pharmacy, in this case it's a place called RAN, it costs a little more, and at Walmart it costs the most per month to fill our prescriptions. We can also see the fact that we're filling all of our medications on a 30-day rotation because all the numbers are the same as you get on the list. All mail order programs fill their prescriptions on a 90-day rotation. So that is why we only see cost every 3 months for the mail order category. At the very bottom of this section, you can see the total out-of-pocket cost for the year, again, which is $2,100. So here's where we can look at the individual costs of each drug. It breaks down for each pharmacy you enter and what costs would be during each phases of coverage, okay? So you can see the retail costs, the cost before deductible, the cost after deductible, and the cost after your out-of-pocket maximum or your out-of-pocket cap. However, because we have 3 generic Tier 1 medications, the cost isn't impacted by the coverage phases. At CVS, all 3 medications are $0 cost regardless. So at the bottom of the page, there is a blue bar that says more drug coverage. So if you expand it, you'll see drug costs by tier level and other drug information. Under other drug information, you'll see their tier level of each drug and if they have any restrictions. So restrictions include your prior authorizations, your quantity limits, and step therapy. We can see that the rosuvastatin calcium has a quantity limit, but if we click on the yes, we see that it's 30 pills in 30 days. So in this situation, we're just fine with what is needed. So once you decide which plan will work best for you, it's time to enroll. Okay, so remember that open enrollment is going on right now. It started on October 15th, and it runs to December 7th. So if you do your review in this time, you'll be able to enroll in a new plan if you need to for next year. So beginning, like I said, already in this process, open enrollment is open. Enrolling can happen online, or you can do it over the phone. You can see the green enroll button on your results page and in the plan details. Once you click on the enroll button, you want to review the information in this pop-up box to ensure that you're enrolling in the right plan. You will see both the plan name and the plan ID. Once you are sure you're joining the right plan, click the green Join Plan button. From there, the enrollment application will begin. So it'll ask you for your Medicare information, your personal information, including your birthday, phone number, your addresses, both permanent and and billing if they are different, and then also some general information. That can include, so the general information will include asking about if you have other coverage, if you want materials by email, if you need information in an accessible format. It will also ask how you want to pay for the plan. So you can receive a direct bill from the plan or get the premium deducted from your Social Security payments or your benefits. Finally, you will state that you've read the plan agreement and you will submit your application. If you prefer to enroll over the phone, you can find the non-member number in the plan details. So if you're enrolling in a new plan, you want to call that non-member number. You can call that number or you can call 1-800-MEDICARE to enroll. If you do call the non-member number of the plan, we want to remind you that these companies also sell other products, and that can include Medicare Advantage plans. So be sure that you have the plan ID, which is going to be on that screen, and the cost available to ensure that you're enrolling in the right plan. The Center for Medicare Advocacy does recommend that enrolling through Medicare directly is usually the best way to go about this. Regardless of how you want to enroll, there's no need to call or notify your current prescription drug plan. Enrolling in a new plan during the open enrollment period would automatically kick you out of your current plan effective January 1st. So you'll get a letter from your current plan letting you know that they will terminate your coverage at the end of the calendar year because you are now going on a new prescription drug plan. So to wrap some things up, we're going to go quickly review some frequently asked questions that we get from folks once they've enrolled themselves in a new prescription plan during this time of year. So what happens next? Well, generally, you will receive a welcome to the plan letter first. This will often include your policy number. It can have your plan card, formulary book, and bills or coupons that should be mailed to you before January 1st. Some plans take a little longer to get that information out to you. If you've not gotten your card by January 1st, don't freak out. You can call the plan directly to let them know you haven't. So the other question is, my current plan is still the best. Do I need to do anything? So the simple answer is no. You don't have to do anything if you are still planning on going with your current plan that you have. You won't receive a new card unless the plan is changing names or benefit managers. Your plan will roll into the new year, but you will see the premium difference on your first bill starting in 2026. So I'll reiterate, if you're not making any changes and you don't want to switch plans, there's nothing that you have to do. So I requested that my prescription plan premium be withdrawn from Social Security, and I just received a bill in the mail. Why is this happening? Well, Social Security generates these statements in advance, and they need a bit of time to catch up with all the changes happening during this time of year. So you'll get a revised statement from Social Security, and it'll reflect that current amount. So it's just because there's a lot of things going on. Just know, just be a little patient. It will reflect in your next statement from Social Security. So what happens if I get a new medication? So more than likely, your new medication will be covered on your drug plan's formulary. After this seminar or this presentation, you should understand how you can navigate some of the Medicare Plan Finder tools. To go onto that site, you can enter, to do the same thing we just did, you can enter that new medication to see what the coverage would be like in the current plan that you are on. So check for yourself to see how it will be covered. This will give you a general idea of what one medication will cost. If you have more detailed questions about how it will impact your coverage phase or payment plan, you could also call your drug plan directly. If for some reason the drug is not covered or it's not covered well, you cannot change your drug plan any time of year, right? It only can happen during open enrollment for the following year. So, however, you can try to get samples from your doctor or use sites like That Good RX that offers those coupons. Another option is that you can apply for a formulary exception from the plan with your doctor. So these are things that you can do if you're taking a prescription and it's not being covered, but it's medically necessary. You can work with your doctor to file a formulary plan exception. As always, review and change your plan in the fall for next year, right? So you can make sure you're getting the best coverage and you're paying the best cost for you. Last question is, how can Everence help? Well, if you are a current Everence Medicare supplement plan client, so you currently work with Everence and have one of our supplement plans, Everence can help you do a Part D plan review. This is done through our Part D service center, and we're no longer offering these reviews in person. It is through that service center. There is a $50 fee per person to have Everence help you with the review. You must sign up for this through our website under the Part D tab. If you're having issues signing up for that and you want to take care of that, please come see me. I can help you get scheduled with an appointment with our service center. Again, this is only going to be available to those who are currently working with Everence for the Medicare supplement coverage. For those who do not have Everence Medicare supplement plans, unfortunately, Everence cannot help you with the Part D review. However, we can help you find, we do have the do-it-yourself resource. This is a video on our website that you can look over that helps go through each process, done by one of our colleagues, Luke. We also have some documents on our table that helps give you some other resources that you can use for Part D reviews. So there's places that does this for you and that you're able to take advantage of to help get your Part D reviewed. So thank you guys for joining this Part D seminar. Hopefully it's helped you get a better idea of how you can do a review and what to look for. We're thankful for the Medicare Plan Finder tool. It is an easy and super user-friendly resource to navigate your prescription plan options each and every year, especially once you've been properly introduced to how it works and how to digest that information that it gives you. If you're feeling like you cannot complete your review on your own, as I mentioned, we have a document with us that gives you other resources that you can use. Shiphelp.org will help you locate your local area agency on aging. These folks provide Medicare support and can do review for free. The document that we have has the phone number for your specific counties. Obviously, we're in Lancaster County, so we do have the specific county office phone number on there if you would like to use them as a resource. And as I mentioned too, if you are Everence member or Everence supplement plan client, you can also use our Part D service center for the $50. We can help you do a review on your plan. And if you need to switch, we'll help you get into a new one next year. Alrighty, so that's the end of all the information. If you guys have specific questions, please come talk to our colleagues. Come see us afterwards. We can help answer that question for you. But other than that, please feel free to stop by our table, grab some resources for you guys. And like I said, if you have questions, just let us know and come see us. Thank you, guys.